So what do you know about HIV?
I guess I kind of know like basic stuff you could say, like, you get it from having sex, or I guess you could get it from like sharing needles or something, and like in the blood and stuff. And it turns to AIDS eventually, like after a few years, and there's no really cure for it. I guess that's what I know.
What I know about HIV? I know that there are different stages of HIV, and some are more serious than others. But once you get it, there's certain measures that you can take to make yourself healthier and just take it from there.
I know that it's a really serious disease, and it's got through sex. Yes.
I know you can get it from touching infected blood, sharing needles, and having unprotected sex with someone who has it.
That it's a virus. They're currently doing studies on it to try to find more medications to help cure it.
Over 33 million people worldwide are infected with HIV. Over 30 million adults and about 2.5 million children under the age of 15. About 40% of new infections occur from male-to-male contact, while 30% are from heterosexual contact, and 25% are from injection. HIV is found in and can be transferred through a number of bodily fluids: blood, semen, vaginal fluids, saliva, and breast milk. However, blood and semen have the highest risk of transferring the virus. There are two different strains of HIV, HIV-1 and HIV-2. A few significant differences separate the two strains. HIV-2 is concentrated in West Africa and is very rarely found in other parts of the world. Furthermore, it takes longer to progress to AIDS and is less easily transmitted than HIV-1. The progression of HIV can be divided up into 4 stages: primary infection, asymptomatic infection, symptomatic infection, and progression to AIDS. Primary infection lasts a few weeks but may not occur for a few months after the virus has been transferred. An individual in this stage experiences flu-like symptoms. The asymptomatic stage can last for up to 10 years. An individual in this stage does not have major symptoms but will test positive on HIV blood tests. During the symptomatic stage, symptoms and long-term infections begin to occur due to damage of the immune system. Damage continues to happen during this stage and through the last stage, which is progression to AIDS. This occurs when an individual's T-cell count is less than 200 cells per drop of blood, where a normal T-cell count generally ranges from 500 to 1,000 cells in the same amount of blood. No cure has been found for HIV. However, medications can be taken to lessen the complications of HIV. Some medications directly inhibit the virus's duplication process, while others interfere with the virus's entrance into healthy cells. Either way, the spread of HIV throughout the body is reduced.
Prevent HIV, just be smart about it. Definitely talk to your partner about it, and be straightforward. If you have it, let your partner know. And then, protection, just condoms. Lots of condoms.
Don't shoot yourself with dirty needles, and don't have unprotected sex.
Gloves.
Universal precautions. Gloves, mask, glasses when you're treating somebody with wounds.
Sex.
Protected sex. Don't share needles for people that do intravenous use of drugs.
In order to prevent HIV, precautions must be taken when coming into contact with bodily fluids. Practicing safe sex through the use of condoms, using sterilized and unused needles or other sharp medical instruments, and wearing protective barriers, such as gloves, when coming into contact with bodily fluids. Educating people and raising awareness is also beneficial in helping prevent the spread of HIV.
Like just HIV itself, I think, is AIDS, and that's really scary to me because I feel like when you have AIDS, like there's like you're kind of like doomed. Like there's no cure for it. So I mean, you can kind of hope for the best, but it's scary because there's no cure, so you're gonna die. And I also think about like in Africa. I don't know why I think of this, but like I know there's like a huge epidemic of HIV and AIDS over there, and I kind of think about like all like little kids. I know there's like lots of mission work going on over there for them because all of the parents have AIDS and they're dying, and just kind of all like the hard times over there. So that's kind of what comes to mind.
It's really sad because so many people die from it, and there's not a whole lot they can do. Like you can take pills and stuff, but once you have it, like that's what you're gonna die of. It's really sad.
My first reaction would be like, just take it from there. Just like, what can we do now, and how can we help the other people who haven't?
I don't really have a reaction. It's just something that's kind of there. Don't really think about it.
It's a scary thing. It's scary.
Feel remorse for that person.
I don't really have a reaction. For me, it doesn't
Kind
bother
of
me.
like all the other diseases that are out there. I mean, you have chickenpox, you have measles, you have HIV, you have AIDS, you have cancers, you have heart disease. It's just another disease.
To figure it out. These kids
So
about
have
it.
caution.
Just educate people.